In terms of the maintenance therapy, yeah, so there have been several trials looking at either how to basically improve the quality of life for the patients. So they have looked into either continuing the same chemotherapy versus continuing downscaling the chemotherapy versus giving chemotherapy free interval. I think right now the current standard based on the number of trials is to consider probably single agent fluoropyrimidine with biological agent like bevacizumab or cetuximab panitumumab. As a maintenance therapy, I think we routinely do it, and it does not affect the overall survival for the patients, or even the first progression is probably sooner with chemotherapy-free interval. But when we reinstitute the therapy and we look at the second progression, patient seems to have the same outcomes whether we give maintenance therapy versus continue with the same aggressive regimen. This is especially true with FOLFOX-based regimen because patient does get neuropathy, and after like 8 cycles, it gets more and more difficult to continue at least at the full doses.